welcome, ladies and gentlemen, Sheena Franklin.
My friend Tiffany enjoyed life. She had an amazing circle of family and friends. She volunteered in her community, and she had a career that resonated with who she was. But when she turned 38, everything changed. She was exhausted all of the time. Her joints ached. Night after night, she would wake up drenched in sweat, her heart racing. Her doctor ignored her symptoms and her concerns and told her it's just a part of being a woman at this stage in life. So she pressed through and ignored all the warning signs until one day she collapsed. And that's when she finally received her diagnosis: lupus. For years, this autoimmune disease had been ravaging her body, attacking her heart and her organs. If caught sooner, treatment could have delayed its progression, but her doctor hadn't been looking. This delay in diagnosing and treatment forced Tiffany to step back from the life and career she loved. Tiffany's story just isn't another personal women's health tragedy. It's an economic problem. Over 80% of autoimmune disease patients are women. Yet, nearly all research is conducted on men. 92% to be exact, leading to $50 billion a year in healthcare costs. I know these scenarios all too well. I'm Sheena Franklin, and for much of my career, I worked on the front lines of healthcare policy and corporate innovation. As a government relations professional and advocate, with leading organizations, including one of the country's largest pharmacy retailers, and working with members of Congress. And no matter how many conversations I had with healthcare executives and policymakers, I kept encountering the same unsettling reality. Women's health is always an afterthought. This just isn't a gap in awareness. It's a blind spot, one that is deeply ingrained, rarely challenged, and woven into the very fabric of how we view women in healthcare. We have been trained systemically, culturally, historically, to ignore women's health. And once I saw this unsettling reality, I couldn't unsee it. It was clear. The most effective way to see change in women's health is by reframing the conversation around it, because the cost of ignoring it goes far beyond the doctor's office. There's the economic cost. The global economy loses over $1 trillion annually in potential economic benefit due to a loss in productivity, absenteeism, and healthcare costs regarding women. And in the US alone, according to the CDC Foundation, employers lose over $225 billion a year in healthcare costs. And a significant portion of that cost is driven by a delay in diagnosing and a lower quality of care delivery for women. And this economic cost, it isn't just limited to employers. Pharmaceutical companies leave billions on the table by failing to develop treatments based on a woman's unique biology, by having just 4% of their pharmaceutical pipelines focused on female-only conditions, despite women making up over 50% of the population, and where the majority of therapeutic patients are women. Consumer health and technology companies also miss out on massive market opportunities by developing solutions based on male-centric data. For example, early versions of wrist trackers and wearables, they did account for sleep patterns and heart rates, but they failed to account for how these metrics present differently in women, leaving women with fewer accurate results. This critical oversight allowed for femtech companies to step in, demonstrating that when companies neglect women's health needs, they lose out of hundreds of millions of dollars, and women lose out in every way possible. Yes, with higher health risks and poorer health outcomes, but also in job creation, economic opportunity, and financial stability. The cost of ignoring women's health is a financial burden we can no longer afford to overlook. What if, instead of seeing women's health as one-dimensional, we consider that it could be one of the greatest economic and healthcare opportunities of our time? What could we achieve beyond a $500 billion market? We could have a future where biomarkers and hormone fluctuations that traditional tests overlook are analyzed to predict heart disease in women before the early warning signs even start by using AI precision medicine to tackle the #1 health killer of women. We could see a fundamental shift in drug development with treatments for diabetes and autoimmune disease finally designed with the woman's unique biology in mind. And then more broadly, we could apply AI to predict sex-specific drug responses. We could have a data infrastructure that protects our privacy while driving innovation by using federated machine learning or even encryption, unlocking new discoveries without sacrificing security or data exploitation. We're seeing slow progress towards this goal, despite limited perspectives. And this is the future of the femtech industry, and it proves that women's health is, in fact, one of the greatest economic and healthcare opportunities of our time. Yes, the industry is still emerging, but we've all been here before. We've seen what happens when innovation meets unmet need. Industries shift, and people are given more control over their personal assets. We've seen this when fintech transformed finance, with new ideas that were once dismissed as niche, ended up reshaping the entire industry operations. Femtech is on the same path, turning decades of neglect into economic opportunity and financial stability. Today, femtech companies are no longer just focusing on reproductive health and digital health apps, creating solutions that are innovative and groundbreaking, designed around the entire life cycle and experiences of women. Corporations and some governments are expanding their women's health initiatives. The UK's Women's Health Strategy, for example, is already investing in workplace policies and clinician training to close long-standing care gaps. And I've committed to this shift. I founded a women's health data and analytics company to close the long-standing critical data gaps in women's health, and by advising health technology leaders and even investors and managing market trends and their women's health strategies, while leading the Women's Health Working Group of one of the largest and most powerful consumer technology associations to create the industry's first set of standards for technologies built specifically for women's health needs and technologies built for the broader population where women are significant users. Society has long promised equity in healthcare, but promises have never saved lives. It's time we stop talking about delivering quality care experiences and we started delivering them. Here's how we can begin. We can challenge outdated narratives about what care should look like by questioning dismissive care from healthcare professionals, refusing to downplay our symptoms, and recognize that when we seek answers, we're not being difficult, we're being proactive about our care. Policymakers, healthcare leaders, and technologists can acknowledge that women's health isn't just reproductive health. By ensuring comprehensive policies and by evaluating product development pipelines and validation methods. Physicians can challenge limited education, industry stereotypes, and biased beliefs. By advocating for more comprehensive medical training, questioning outdated diagnostic criteria, and recognizing that women's symptoms often present differently. So, my question to you is this: are you ready to rewrite the future of healthcare? Thank you.